enjoy the most about being at the conference is just being immersed in this atmosphere where we get to learn from each other. It's just very warm and welcoming.
I get a chance to talk with my peers, I get a chance to talk with people that I admire in the field, I get a chance to interact with leaders, and they give me an idea of where I want to take my research, where I want to take my career.
For me, at this stage in my career, I am just here because of all of the communication I get with all the people that are so smart and so creative and so passionate about their work.
I enjoy being here with other psychiatric mental health nurses and re-engaging with the old friends and meeting new people.
I normally find really great research coming to the conference. Each year it sort of updates my practice a little bit more.
I've been into like ketamine and TMS and all these things, and I get so much knowledge coming here, and I'm able to disperse that knowledge to my colleagues back home.
The content of the presentation is going to make me perfect my craft in how I am going to continue to take care of my patients, and as well taking care of myself.
I get revitalized in terms of what my practice is. I come away with ideas of what I might want to do next.
Hearing the stories of people, hearing the sessions, listening to the learnings from the different sessions, it made me really get energized that I go back.
I believe the biggest thing that I'll walk away from this conference with is just contacts and networks and people I've met.
What is best practice? What is evidence-based? This is a great place to meet people who are doing what is pushing the boundaries and in a meaningful way.
Nursing is a lifelong learning career, and things are always changing, and if you're not learning, you're not living, is kind of my motto.
I always bring students every year to this conference, so I'll have 1, 2, sometimes we'll have more, and we even get them presenting, we get them involved, and they get, for a lot of them, it's their very first experience at a professional conference.
Everyone's a friend. They will not withhold any information if you just asked, so they'll make you feel very welcome.
I do not teach students, but I teach patients, as we all should as nurses, and it pays dividends to be knowledgeable about all the different resources patients can acquire.
One thing that stood out to me the most about coming to this conference is the fact that you can just jump into any kind of subject that you're looking for.
We're not experts at all of the subspecialties, but we're able to hear from experts in so many subspecialties, so it's really, really convenient and helpful.
Anybody who works in behavioral health can benefit from coming to one of these conferences.
It targets nurses at different levels. It targets nurses in their field as a research, and targets them as clinical practice. And it also provides a supportive environment where nurses can share their experiences, their challenges.
We can eat together, we can sit down in a chair together and have a conversation and feel support from colleagues who might be experiencing some of the same challenges or some of the same successes.
It just compels me to come year after year. There's something about being in this atmosphere that is just so fulfilling.
But I think it's a kinship. It's I call them, we're with our peeps. So we get a chance to kind of see like-minded individuals, and I think that's just critical to do in today's environment.
I am telling all psych nurses, wherever you may be, you need to come to the next conference.